Americans, many of them 65 and older, are estimated to have Alzheimer's disease, and it's currently ranked as the 7th leading cause of death here in the U.S. Early signs and learning the symptoms could help slow progression. So joining us right now is neurologist Dr. Ira Chang with HCA HealthONE Swedish. First off, thank you so much for joining us. We appreciate that.
Thank you for having me, Brian.
Let's talk about the difference between Alzheimer's disease and perhaps normal age-related memory loss. What are the differences there?
So people can get older, can get forgetful as they get older, but usually in normal aging, there's more of a slowness of processing. And even if people forget, they usually remember what they forgot if they're reminded. In Alzheimer's dementia, if they forget, they don't even remember anything at all. And there are other signs such as behavioral changes, physical and cognitive dysfunction, and other cognitive dysfunction that's more than just normal aging.
So for loved ones, that's kind of easy to pick out if you know this person well. Like you would see these signs.
You should really see these signs, but because they progress very slowly, sometimes people don't really notice it until something happens. Someone goes in the hospital or someone goes out of town, and then all of a sudden they realize that they can't take care of themselves.
What's the latest in terms of treatment for Alzheimer's?
So really, treatment consists of medication and non-medication, but there are pills and medications that can improve the function of the neurotransmitters that are affected in Alzheimer's, and that can slow progression. There are IV medications now that can break down the buildup of amyloid plaques that are seen now even as early as age 40 and 50 in brains. It remains to be seen whether that can regress progression of the disease, but it certainly can slow it down.
How has our understanding of Alzheimer's changed over the years? I mean, some of us, we do like crossword puzzles, or we try to just get, exercise the brain, if you will. And does that help too from that?
Yes, I think lifestyle and behavioral changes have also been shown to be helpful, not only in slowing progression and maintaining quality of life, but also in reducing the risk of developing. And those things are like maintaining motor and mental activities, getting adequate sleep, because that's when our brains reset processes for the next day. And social interactions are really important. Social isolation has been shown to increase the risk of developing dementia.
Very interesting. Is there a message that you want to share to families who are experiencing this perhaps for the first time?
Yes, I think that it's very, very crucial and important to try to encourage people to get tested and to get on treatment as soon as possible, because everything that's available can really help slow progression and maintain the disorder. But a lot of people don't get diagnosed until they're in their 80s, and by then the disease is already moderate to severe. So it's just imperative to try to encourage someone to seek some testing, simple screening tests. And I know it's a difficult conversation, but it's really the best way to maintain their quality of life.
And one last question here. From what we understand from Alzheimer's, is it hereditary in any way, or we just don't know that answer as of yet?
We don't really know that. It's not like the typical hereditary. There are some genes that can be associated with developing dementia, but it does not mean that you're going to get it. So still prevention, healthy lifestyle, seeking diagnosis is still the best way to maintain a longevity and quality of life and functional independence.
All right. Well, thank you, Dr. Ira Chang. We appreciate your time. Thank you so much. You can watch all of our interviews, by the way, on our website at cbscolorado.com. Michelle?
All right. Well, another